morning. Thanks for joining us. I'm Judith Garza, and with me today I have Iyaba Morrison, Kevin Sheriff, and Nicholas Hickman. On today's broadcast, we'll cover a variety of topics, which include EIV, case management, the next generation VMS rollout, DIS updates, the DHAP-Ike conversion conversation that's been long overdue, and the DHAP-Ike extension. A couple of numbers to bring everyone up to speed with on our current state of the program. Currently, we have 5,153 households who are currently participating in DHAP-Ike. The majority of these households are spread between Louisiana and Texas, with several still in outlying states. This is a significant drop from our original referral of 51,857. And as you remember, there was a lot of work that's gone into that number and to whittle it down over the past couple of years. And it's that number and the number that we have right now that's made the compelling argument for the DHAP extension. Now, as you know, we're scheduled to end the program March 31st, and we've been in talks about an extension and a conversion for quite some time now. And it's because of the numbers that we have, the 5,153, and the fact that this population is probably the hardest population we've yet to see through DHAP, that OMB has decided to extend the program. Now, I say OMB has decided to extend the program because that's actually how this extension has rolled out. We've submitted all information to OMB over the past 4 months, and they, along with the state of Texas, Louisiana, and FEMA, have been looking at the population and considering what to do next. As you know, we're in a pretty conservative climate right now fiscally throughout the government, and as our last broadcast in December, when we ended with not quite, the security of whether or not we were going to get the conversion, I still have no updates to report on the conversion. One thing for sure, though, because of the fact that this population is the hardest hit, and even though we're in a pretty tight budget year right now, all parties have agreed that an extension is necessary to continue to assist this population. And I, again, as we mentioned in December, I attribute that completely to you and all the work that you're doing out there. The information that you're able to get us on these families and their situations and their financial limitations has really been essential in telling the story of this population, and has directly impacted whether or not we were able to get this extension. While we would like to have gotten news to you a little bit sooner, we are excited that we at least have that to confirm right now, and that both states are on board. Now, something interesting about this extension is that it's not for a full calendar year. The extension as it stands, as it's been approved, has only been approved through fiscal year 2011. That is the end of September. With that in mind, OMB has decided that we will continue to push for conversion vouchers, and we will continue to make the case for this assistance for these families. And that is the time frame, which is 6 months from the end of the program right now, that both states and FEMA have decided is appropriate to be able to assist these families and continue to push for conversion vouchers. If we should have a conversion, something that all parties have mentioned to us is that they expect that this conversion should take place pretty quickly. And given the statistics and the demographics of the people and where they are, we think it should happen pretty quickly as well. A couple of factors we're not looking at this time around are THU families. As you all remember, marketing to the THU families, getting them to be interested in a conversion voucher, getting them to apply for them, did take a lot longer than anticipated. It was not ever really the population that were currently under DHAP in temporary housing or apartments or homes that we were assisting that was the problem. They were able to convert in place most often, with a couple of moves here and there because of HQS. But for the most part, those went over pretty smoothly. Being that that's the majority, actually the sole population that we're looking at this time, we expect that conversion should happen pretty quickly. Clearly, there'll be a couple of exceptions: units that don't pass inspection, households that don't pass background checks, things like that. But for the most part, based on the information that we've gotten from you all, we feel pretty confident that we can try to meet the expectations of FEMA and OMB that a conversion would occur 3 months maximum from the end date. Now, that end date can change. That, as you all have seen through the course of this program, that end date moves around quite a bit. But for what I can say right now, we have no approval of conversion vouchers at all whatsoever. What does this mean to you? What it means is that since we have no approval of conversion, the program will continue to run as it has been running. just continued with HAP assistance, HAP payments, quarterly evaluations, and meeting with the families. We are going to stand down from any HQS inspections that have taken place, and we don't want you to do anything that would incur fees on your end. And if this is already something that's happened, I know we've been receiving a couple of email questions from you all, and we'll definitely address those one-on-one with you because some cases are very specific, but also we'll put them out in an email as generic or general as possible to scenarios that could apply to other PHAs based on the frequency of some of these issues that come up. But again, we have no news on conversion as it stands. However, they do see a need for this. It's just a matter of funding. As you've probably seen in your other HUD programs, funding is an issue, and as you've probably heard and read, a lot of federal agencies are currently impacted by funding cuts. So it's something that it's good to hear that they support funding for conversion vouchers, but it's not guaranteed. With that, I will turn it over to Iyabo Morrison, who will discuss case management and alternate resources.
Okay, thank you so much, Judith. For those of you who are not aware, again, my name is Iyabo Morrison, and clearly I work with disaster housing programs here at HUD, and it's my pleasure to be here today chatting with you. As Ms. Garza has just explained about the current status of the DHAP-Ike program, there are a couple of takeaways. Again, DHAP-Ike is a temporary housing program, and as it stands, there is no guarantee that voucher funding will be provided at the end for a conversion. So agencies might currently have the ability to utilize existing resources to provide housing to their DHAP-Ike families. So this may be an avenue that you all might be interested in pursuing to provide a more permanent housing option for these families at the end of the program. As well, some agencies may not have resources to absorb families, so we really encourage grantees to start seeking out other housing resources within the community that might have availability. Some jurisdictions do have short-term rental assistance programs for families who have been affected by Gustav or Ike. So housing agencies might want to seek out these programs for some ongoing housing assistance for these families. And your state office of disaster or your state community development office might be a good place to start to identify these resources. For grantees who have participants who are veterans, who are elderly, or who have persons with disabilities, there might be some special programs that could provide additional assistance. You might want to seek out the U.S. Department of Veterans Affairs, area agencies on aging, state disability offices, state and local offices of elder affairs, state offices of Veterans Affairs, or centers for independent living. As well, some local agencies that are funded by the United Way might actually have some more specific programs to assist individuals who are displaced. With respect to other federally subsidized housing programs, grantees may want to investigate the United States Department of Agriculture. They have a rural housing service program, also, of course, HUD multifamily housing programs. As well, the U.S. Department of Veterans Affairs has programs for homeless veterans as well as home loan support for veterans, so those are resources you might want to seek out, as well as state supportive housing programs. In addition, the USDA as well as HUD have web portals for subsidized properties by state. So if you were interested in receiving those links to the states, you can send an email to DHAP-Ike at HUD.gov, and they can forward that information to me, and I will get back in touch with you with more information with those links. Also, with respect to multifamily properties, your local HUD office should be able to provide you with a listing of subsidized units within your locality. Now, please note that there are most probably waiting lists for these units, but it never hurts to check and see what might be available. In searching for other housing options, you might want to visit this HUD website, which is HUD's Homeless and Housing Programs website. The web address is www.hudhre.info. Again, that is www.hudhre.info. Here's some exciting news that you all will probably be happy about. Please note that grantees now have the ability to utilize the Enterprise Income Verification System for DHAP-Ike. I know this has been a long time coming, and I'm quite pleased to tell you this information. If you are in need of information on the EIV system, please go to the HUD homepage and place EIV in the search window. Your local field office can provide you more details on how to access the system. But please make sure prior to utilizing EIV for your DHAP-Ike participants that your agencies do have the appropriate release of information on file that is signed by family members in order to access this data. Recently, disaster program staff here at headquarters have been receiving phone calls from landlords who have not been receiving housing assistance payments from agencies that on behalf of their Ike tenants. Upon research, it was found that some housing assistance payments were not being made for a variety of reasons, but most often these payments were not being made due to noncompliance on part of the family. And I ask that you refer to frequently asked question number 66, and this will reference the issue, but I'll go into a little bit more detail now. Can a PHA withhold or abate a housing assistance payment to a landlord if the family is non-compliant with program policy? A housing agency should not withhold or abate a housing assistance payment to a landlord as a corrective measure for families who are not compliant. For example, if a family is not compliant in submitting information requested to HUD or the housing agency in a timely manner, the family is in violation of their family obligations and could be subject to termination of their DHAP-Ike assistance. The appropriate corrective measure in this scenario would be to proceed with terminating assistance in accordance with standard operating procedures with the DHAP-Ike program. To terminate assistance due to noncompliance, the agency must give the family an opportunity to request an informal hearing, and these procedures should be in accordance with your agency's administrative plan. And if a hearing is requested, the agency must proceed with the hearing in a reasonably expeditious manner. If the family requests and receives the informal hearing, the family cannot be terminated until the hearing officer has provided a written decision. So this guidance is in PIH Notice 2008-38. And if you have any other questions regarding this particular subject, please contact Ms. Teresa Palladino, and she will be more than willing to respond. Also, one other note, the department is in the process of identifying families who do not have a disaster rent subsidy contract executed. So Ofori and Associates is in the process of reaching out to agencies in order to close out these cases. So if you do receive a phone call from a field representative from Ofori wanting some information, please work with them so we can get these cases resolved as soon as possible. At this point, I'll get a little bit more into detail with case management. Case management efforts should take into account the housing status of families upon the completion of DHAP-Ike. So please start actively working with your families to identify what their plan is once the program is over and what steps they plan to take in order to reach that goal. This would be a good time to start discussing what options might be available. For instance, what are the plans for a family who might not meet eligibility requirements if they were seeking some federally subsidized housing? So in the case of somebody with a criminal background, what are some housing alternatives that might be available to a family such as this? Also, your social service referrals must be made by case managers relative to the individual development plan of that individual. Referrals should be specific to participant needs and based upon information gathered from the needs assessment and the individual development plan. Social service referrals, enrollments, and resident outcomes, of course, are to be documented in the Efforts to Outcomes software, which is our case management tracking system for DHAP-Ike. Documentation should be recorded under the Record Referrals for Crisis and Secondary Needs. As always, referral follow-up is required by case managers to ensure timely service delivery. It is strongly recommended that follow-up on referrals occur 30 days with clients and service providers. Case managers are required to update referrals in the case management system under View and Update Progress on Referrals. Ike participants should be encouraged to contact service providers independently, and referrals should provide the participant with the service provider contact information as well as the contact name, and this information should be listed in ETO as well. And I make mention of this because I have been in the ETO system sometimes, and I'll be looking at the actual referrals in the system, and I might see a name or an incomplete service provider and really are not aware of what the service is for. So if you can be as complete and detailed as possible with that information in ETO, it would be appreciated. And as you know, for tracking purposes, grantees will be monitored by the service referrals which are entered into the system. So if you are identified as having missing referrals or unresolved referrals, that's where we come up with those data elements. Please note that reassessments must be updated every quarter for the duration of the program, and participants may be reassessed more frequently if it is deemed necessary. It's recommended that an individual needs assessment be established for all family members over the age of 18, and HUD minimum reassessment requirements should be completed for the following areas: updated income information, updated employment information, and updated employment readiness information. I also want to make mention of this as well because when I go surfing through the ETO system, sometimes I might just pick a random family and we'll pull up a custom report, and that family might be identified as a Tier 1 or a Tier 2 family. But based upon the efforts in the system, I may see that the family seems like they should be at a higher tier level, maybe a Tier 3 or a Tier 4. At that point, I'll look at the most recent assessment, and sometimes I have found that one of the 3 areas that we require is not filled up. And so that would be one of those areas that might have a significant impact on how the family is tiered. So please make sure that you, of course, do a thorough reassessment, but please complete those areas related to employment readiness, and income information. The case management tracking system does allow case managers to enter a final housing status for closed cases under the record efforts toggle bar of the software. Undocumented efforts should be input for participants who've had their participation ended in DHAP-Ike. If you have difficulty accessing the clients who have been EOP'd, you can contact your Information Pathways representative and they should be able to help you. There's a new feature with the ETO software which will allow those individuals who have the role of site administrator receive copies of the closed case emails that a case manager would receive after the DIS file transfer. When agencies are completing their continuing eligibility determinations on the rental side, it's good practice to refer to the needs assessment of the family to compare the income information noted in the assessment versus what the family is reporting to the housing counselor. If there are discrepancies noted, this can be addressed with the family to confirm which income is actually the true income. Of course, it's not too early to begin thinking about closeout, and we're at the point where we do have a number of families that have been EOP'd from the program. So you'll want to take care in reviewing the files of EOP'd families to ensure that necessary documentation is in those files. We do understand that since these families are EOP'd, agencies might not have the ability to collect all information, but please do the best you can. And please take advantage of the go-to meetings. These are webinars that are available for agencies to assist them with use of the ETO software. So in order to schedule a live meeting, you can reach out to your Information Pathways technical assistance provider. They can provide refresher training, they can assist with downloading information, or anything else in terms of reports. And ensure that your required file documentation is present and up to date. So of course in your case management hard copy, you're going to want your release of information, a certification of family obligations, and a signed copy of the individual development plan. When you're completing your quarterly reassessment or your continued eligibility determination, this may be a good time to bring paperwork up to date if the need exists. And when inputting efforts into ETO, please do not use the Track Contact Attempts drop-down menu. When you're recording efforts, you need to utilize the Record Progress toward Main IDP goal. Please be aware that ETO will not be available to agencies once the program is completed, and we will notify agencies in advance of the date that the Efforts to Outcomes software will be shut down. So administrative users do have the ability to download archival data, and if you have checked into your site administrator webpage, you will see the download instructions are at the top of the page. more detailed instructions can be sent on downloading this information on the webcast notes, but of course it's on your web page if you're a point of contact, or Information Pathways can provide more information. I would like to congratulate our grantees. I have noticed that in the software you all have been making very diligent efforts to reduce the number of missing and unresolved referrals. So thank you so much for doing that. And of course, please follow up on referrals. And if you do receive a deficiency report from your TA provider, please make sure that you follow up with them within 10 days. There are now 2 case management technical assistance providers, and of course they can provide you information on resources and support for case management and software. Vanessa Patterson covers the state of Louisiana and parts of the rest of the U.S. Her phone number is 239-242-0665, and Yvette Campbell-Smith covers Texas and other parts of the U.S., and her number is 713-655-0332. As always, thank you so very much for your hard work and all that you have done on behalf of our families. We really do appreciate your efforts. So at this point, I think I have talked quite enough, so I will turn it over to Mr. Nick Hickman, and he will provide some information on how to input new leases for the incremental rent transition.
Thank you, Yabo. Good morning. My name is Nicholas Hickman, again, with the resident group here. Today I'd like to speak about the process that the user should take when entering information for their family's leases in DIS. As you're aware, families who meet the hardship exception in the program, which means that their incremental rent transition will be frozen at a point in time that the Housing Authority has deemed appropriate, they should enter this information into DIS. Throughout the course of the program that a family is participating in this program, the family may encounter several hardship situations. And in that case, the system is designed to track the different levels of the hardship that they meet and to track the IRT exception amount that the Housing Authority will be responsible for towards the rent of the family. I will briefly go over a slideshow here of what the system looks like and how to properly enter this data into DIS to ensure that the Housing Authority is first tracking the information correctly in DIS, and second, to ensure that the funding is appropriately assessed towards the eligible families to receive the assistance, and the Housing Authority is reimbursed for the amount provided, for the amount of assistance provided. In this first slide shows an example of a DIS record of a typical family receiving assistance. As you can see, in several different areas of the record, the very first point you want to look for is making sure that all the checkboxes are checked for the family's been contacted, the family agrees to case management, the landlord has signed the HAP contract. In addition, you want to ensure that values greater than 0 are entered in the payment standard field, the FMR field, the rent-to-owner field, the lease rent field, which calculates out the HAP total field. In that HAP total field, that is the amount of subsidy that the family rent will be attributed to. In this situation, when the family has met the hardship exception, or has met a hardship waiver, and they need a hardship exemption for their share of the rent as the IRT has begun May 2009, the landlord will go into the current lease of the family. In this situation, it's lease record 1, and they'll check the box IRT exception. Once that box is checked, you will be required to enter in the date that the IRT exception begins, the IRT amount, which is next to that date field, which is the amount that the PHA's portion of the rent, or the amount that is frozen of the IRT step down for the family, will be assisted. In addition, please write in comments into that IRT exception field noting the amount or the circumstances for the family's hardship exemption. In this next shot, you'll see that further highlighting the areas where it's important to make sure you fill out, which is that IRT date, the IRT amount, and the comment section. Several points to keep in mind is the date field. That date needs to be after the HAP contract effective date, but prior to the HAP contract termination date. In addition, that amount of the IRT amount, just to reinforce, needs to be the amount of the PHA's portion of the rent. And that portion, as some of you have may seen, could be the entire HAP total because the family meets a requirement that they cannot afford any of the IRT step down, or maybe a portion, whatever that amount is. It's important to remember that in these updates that if the family only has one hardship waiver, to only update the record that the lease is active. I'm going to move forward here a couple screenshots. Once you've entered in that information to the IRT date, amount field, and comment field, you'll just simply go down to the bottom of the lease record and click on the button Update Current Lease. That simply just saves the lease for the information you've entered in the IRT amount fields. However, as I mentioned before, there are some circumstances where a family has met an additional hardship throughout the course of the program. And as an example, I will walk you through the steps needed in this next slide to show what you should do to ensure that the record is properly updated on the first lease and that IRT exception, and to track the second hardship waiver on the additional leases. You'll follow the same process for each time a family has a different hardship exemption to their subsidy amount, and only for a family who's received a hardship exemption. That's a key point to keep in mind, is that the IRT exception checkbox, date, amount field, the exception comments field are only for when a family meets a hardship waiver. It is not intended to track the IRT step down in the normal course of the program. That isn't tracked in the lease simply other than as the HAP total being the correct amount of subsidy that the family qualifies for. The step down is calculated outside of the DIS program. Moving on, when a family receives an additional hardship exemption, what you will simply do is go into the current record that you've made the first IRT exemption amount in, and as you can see in this slide, there's the information that we entered in an example for this family where we checked the box for IRT exemption. We noted that the exemption begins on June 1st, 2009, and we entered that date in that date field, and we entered an amount of $950. So as an example, this family could no longer afford more than $50 towards their rent in the course of the program. So that means that the amount that the housing authority will pay towards the family's rent, the PHA's portion, will be frozen at $950 for the course of the program or until the HAP contract termination date has been met, whichever comes first. Moving on to the next slide, we see that the family in this situation has met a new hardship waiver or hardship exemption. So in this situation, what we want to do first is update that current record, and we're going to change the HAP contract termination date. And that HAP contract termination date will be the date of the day before when the new IRT exception date begins. So in this situation, as you are in that current record you're in, you're simply going to be updating this record. And just to fast forward quickly through, once you enter in all the new information to the new IRT exception amount, you're going to create the new lease by clicking that new lease button. However, stepping back, we want to go through the correct fields to update to ensure that you're properly tracking this exemption amount in the record. So as I mentioned, you'll update that HAP contract termination date to be the day before the day that the new IRT exemption amount begins. Once you've done that, you'll click Update Current Lease. And what that will do is you're updating that first lease, so you're ending that HAP contract termination date, simply just in DIS, not in the hard file, not with the landlord, but just simply to track it in DIS. Once you've hit update current lease, you'll go back into DIS, you'll go to the family's record, locate the family's record. You'll go down to the bottom of the lease record to enter in the new IRT information. So in this slide, you'll see that the IRT exemption field is still checked with that. Well, this will be the new data, but it will still show the old data. But you'll go in and update. And as you can see, under HAP contract termination date, we updated the date to 10/31/2010. And under IRT exception date, we put November 1st, 2009. Excuse me, I want to back that up for 1 minute. The dates here are a little contradictory, but we just want to ensure that what you will be doing with the lease termination date, or excuse me, the HAP contract termination date of the first lease will be the day before the second lease record in DIS. So that IRT exemption date will be the day after the HAP contract termination date of the first lease. You'll enter the new amount of $1,000. So in this situation, the family had a change where they may, let's say they've lost a job and they've met a full hardship waiver. So the PHA is going to pay the whole rent for the preceding months until the end of the program. So you want to track that the IRT exemption amount changed from the first lease, from one point in the program assistance of the family to the second point. So as you can see, you're going to update the full amount in the IRT amount field, and then again make further notes in the comment field. And once you've made all these updates, you're going to go to the bottom of the screen, and as the slide doesn't show here, but you'll go to the bottom of the screen and hit create new lease record. When you create that new lease record, what that does is it then creates two lease records, as you can see in the screenshots, that there will be the first lease record showing that the family qualified for a hardship exemption of $950 that the PHA will pay for. However, months later they met a new hardship exemption where their full amount of HAP subsidy will be paid for by the Housing Authority. You'll follow that same process each time a family qualifies for that hardship exemption, making sure that the proper date fields are met, which are the IRT exemption fields. The HAP contract termination dates are always a day apart. If you have any further questions you'd like to go over this in more detail, you can certainly reach out to us at DHAP-Ike, at the DHAP-Ike mailbox, or call me directly at my number, which is 301-718-7118, and I can go over in a step-by-step process as well. Thank you again for the time this morning, and I'll pass this back to Judith.
Thank you, Nick. Thank you for going over the IRT information. That's something pretty timely right now. As many of you have probably noticed, QAD teams are out visiting your PHAs and bringing up concerns or questions on information that possibly might have an interpretation issue. I mention this because I've recently been informed that online, if you Google our FAQs or DHAP guidance, there tends to be conflicting information on FAQs that weren't updated correctly. An example of this is deposits paid, and when individuals leave units. As you all know, DHAP is a constant evolving program, and a lot of this is due to the fact that it's not traditional and that we are responsible at the end of the day to FEMA based on their eligibility. So there are a lot of things that we put in place at the beginning of the program that as it starts to unroll and unravel, we don't necessarily account for. A perfect example of this would be deposits and individuals who've left units because the program was ending, not necessarily because they were able to. In the FAQs or the guidance, there is very firmly written guidance that says that no new deposits can be reissued. Deposits can't be reissued to an individual. However, we have said before on broadcast that you have case-by-case scenarios. A perfect example, I go back to individuals who've left because they've not been notified until the 11th hour, as we all have, that a program has been extended. Now, not to belabor the point that sometimes extensions take a while because many stakeholders have to agree to extend a program. We know that there's quite a bit that goes on up here, but it also has a severe impact on you and the families that you serve. Because of that, we make exceptions, and because of that, we definitely tweak our guidance and our guidelines. Is it always captured the right way? We'd like to think that we say this in broadcast and send it out to you in notes, but apparently it doesn't always get updated to what's out there on the web and what people can access. So again, I apologize for any of that, but we've been told that there are outdated FAQs and outdated guidance out there, and we'd like to take this time while QAD is out there finding these things to update everything we possibly can on the program and possibly give more clarification. It's been really interesting having QAD out there with us to be able to come back to us and say interpretation could go either way on some of these things. All income calculations has been one of the biggest hot topics that we've had lately. There's a question on income from minors, what constitutes a minor. There's a question on calculating net income, gross income, and income tax refunds. And calculations like that often, if not done correctly, and correctly is loosely defined sometimes, could impact the family on whether or not they not only exit the program sooner than they should, or if their contribution to the program, to their household HAP payment, is greater or lower than it should be. And because of these things that QAD is finding, we're going to compile everything that we can to send out to you and clarify these issues, plus some of the ones that you've raised over time, and send out a definitive, most updated FAQ guidance, something that just is obvious that this is the most recent, because again, we're very concerned what's out there on the web that people could possibly be referring to and is outdated. And when we have exceptions, like deposits, we definitely want to make sure that we touch on that, and maybe we need to spell it out a lot more, that these are exceptions because of program end dates and things like that. Yava brings up the FAQs as well because they also help us on the case management side, and it's something that we also really need to take notice of when the QAD staff is out there, that the rental side and the case management side coexist but should be running concurrently and very closely together. So as we update everything on the rental side, we will continue to loop IABO and the case management side in as well, so that we can make sure that everything is consistent and together, and that you have the most recent guidance. It's one of the good things about being extended an additional 6 months. That gives us 6 more months to tie some of these loose ends together, because again, we really want to tell the best story of DHAP-Ike and all the work that you've been able to do out there. You've come just such a long way from our initial DHAP Katrina program, and the leaps and bounds in processes, in programs, and doing the work. We want to make sure that we adequately capture that. We also want to make sure that we give you the guidance to be able to do that. So I was also very excited when she was able to tell you all about EIV. I know, as she mentioned, it's been a long time coming, and it's something that we're beginning to wonder if it was an urban legend or not. But we do, in fact, have it now. With the 6-month extension, it gives us a little bit of time to see how it rolls out, and should we get a conversion, it will be very timely in assisting us with this conversion. So we also look forward to that. So. With that, something else that we look forward to is NGVMS, Next Generation VMS. I know for those of you who have worked DHAP before and are working DHAP now, you have often had the difficult task of trying to reconcile DIS, VMS, PIC, and so on and so forth, and we applaud you, and we are grateful that you're able to maneuver throughout the different systems and so on and so forth and roll with the punches as we roll out things. But with that in mind, we definitely have seen that there is a need to consolidate systems, to simplify systems, and to have everything housed differently. And with that, we have the NGVMS, the Next Generation VMS process, or I don't know what to call it. I'll let Kevin give it an actual name. But we've got that coming up. We're pretty excited about it, because what it is taking how we do business, taking everything that you all do out there, and creating a better way of capturing the work and the information. As you know, data in, data out. What you put in is what we base everything from funding to numbers to projections to reports to the Hill on. So capturing what you put in and all the work that you do at the PHA level is critical. It's critical to us here because it helps us know how much money to push out or how the program is working. It's critical for shortfall. It's critical for front loading. It's critical for so many different things. but it's also critical on a bigger national level when telling the story of what you all do, how the families are assisted, the duration, the demographics, the income issues, et cetera, et cetera. We rely heavily on everything that you put into these systems to be able to really explain what HUD is doing, what the PHAs are doing in the community, and how much assistance we still need. And as I mentioned early on in the beginning of the program, with funding cuts and budgets being an issue nationally and throughout the government, it's all the more important that we represent these figures correctly. So with that, I will turn it over to Kevin Sheriff, who will explain to you and describe this exciting venture in GVMS and our visits to the field. Kevin?
Great. Thank you very much, Judith. My name is Kevin Sheriff with Deloitte, and I'm the project manager for the Next Generation Voucher Management System effort. And while I know that's a mouthful, we hope and fully expect that the results of this effort will greatly simplify your lives in providing that very critical data that Judith has talked about. So what is NGVMS? It's a business process reengineering effort of the programs, processes, tools, data that you all use and interact with and interface with on a daily basis in support of multiple HUD rental housing assistance programs, including all the voucher programs and other programs that you and other rental housing assistance providers participate in, including DHAP. So right now we're in the process of trying to identify what we call the current state of these programs and the processes and systems and tools that support them. And in order to fully understand and comprehend the current state, we need to talk to you all. You're on the ground operating these programs on a daily basis and making them work for the families that you serve. And you're the ones that are having to use the systems and report the information and get the assistance to these families. So with that, as part of this current state assessment that we're performing, we're going out into the field to talk to PHAs and other rental housing assistance providers participating in HUD programs to really understand and fully comprehend, like I said, how it is you make these programs work for the families that are receiving the critical assistance you provide. We've already actually conducted one field visit and met with multiple PHAs and received some fantastic feedback about what it is you all do and how you make these programs work and how you input data into the system and how you pull data out of the system and how you forecast your budgets. And so these meetings are absolutely essential and critical to this effort because of your fundamental role in operating and managing these programs. So with that, we're going to be out in the field quite a bit between now and the end of this project, approximately 9 months from now. We're heading to Texas very shortly to meet with PHAs in that region to specifically learn about how you manage DHAP-Ike and other rental housing assistance programs that you're participating in. So I'm really looking forward to getting out there and meeting with you all and hearing the challenges you face and the experiences you have in helping to serve these families. Like I said, and I will say it 1,000 times, your feedback is absolutely essential to this process, and this cannot be a success without all of your help and all of your experience and all of your significant knowledge that you bring to the table. So, thank you.
Thank you, Kevin. As Kevin mentioned, we'll be making site visits, or the contractors will be heading out to the field offices, the hubs, the PHAs, and they'll be meeting with you all. But these visits currently are being developed. We're looking at what states, what areas, and taking several things into consideration. In the event that we don't get out to your PHA, feel free to contact us. You can email us at any time. We have a limited amount of time, and we have a lot of development to do, and we have a limited amount of visits that we can do within this time. So getting out to every PHA, and specifically non-DHAP specific PHAs, is a challenge. So we need to make sure that we equally and fairly hit all the regions as much as possible throughout the U.S. So should we not make it out to your PHA, please don't feel slighted, but you are more than welcome to contact us and give us your 2 cents on what your input is, how you use it. We are really interested in knowing not just what is great about the system and you like and works well for you, but also what doesn't work as well? If we see a PHA struggles with data input, that's pretty important because there's got to be a reason why there's some struggling going on. There's got to be a reason why maybe the system's complicated, maybe it's a software issue, maybe it's accessibility, et cetera, et cetera. And Kevin and his team have been working with HUD for about 8 years, or?
It's been a while, and so we've seen these programs up close and personal. We've seen PIC, and we've seen VMS, and we've seen EIV, and we've seen DIS, and we know some of the challenges you face in managing data across several of these systems, and we really want to learn from that experience. So.
Well, Ed, something really important to remember about these visits is that it'll be Deloitte and their team. There won't be, maybe there might be an exception here or there that there be a DHAP person along, because we'd like to get out there and visit you as well, take advantage of jumping on their trips and visiting you guys. But for the most part, it is Deloitte and the team, and they'll be going out there and specifically talking to you only about systems. Now, this is very important because to make the most of these limited visits and the time frame that we have to make them in, it's really important that everyone understand that this is PIC, VMS, DIS, sensitive only. No policy, no program, no procedures. Nothing traditional HUD business will be going on, or nothing, we can't offer any guidance on that. This is solely about systems, how you use them, how you access them, obstacles, and different things like that. So we really want to make sure we say that up front. We say that for a couple of reasons. We want to manage your expectations of what you're going to get out of these visits, but we also want to manage the expectations of what you can ask the staff here who will be going out. We want to make sure that you understand that policy questions or what have you, we'll try to answer on our end as quickly as possible for you, but while they're with you, we want you to speak freely about the systems. So, what you'll get out of it, but also what you'll be able to say about the visits and about the systems is really important that you know. It's solely IT sensitive or IT heavy or what have you. And these visits have been really, really interesting. We've gotten some good feedback from people, a lot of good feedback. So we've got wish lists of things that are coming in, and folks who, after visiting or after being spoken to about in their interview, they've sent back lists of stuff that they'd like to see added as well. Oh, I forgot to mention this, or I forgot to mention that. And Kevin, you guys welcome that, don't you? Oh,
we absolutely want your ideas for how to improve the systems that support the rental housing assistance programs that you all operate, and the more ideas the better. Certainly HUD can't promise that every idea will ultimately be implemented, but we need a lot of your ideas based on your experiences with the systems and the programs, and those ideas are what's going to make this project a success.
Exactly, and this is not in any way shaped to circumvent all of the assistance that Nick and his team are providing by any means. Continue to route those things and those questions in those issues, and continue to work with Nick and the Ofori team as well, because they're assisting with what we've got the here and the now. The as-is phase, or the to-be-built phase, or what have you, that's Kevin's team. So definitely continue to work both angles, because Nick can help us and continue to help us with any questions that we have currently and with the business that we're doing right now. But we kind of look at Kevin's teams as the collectors of our wish list of things. So, definitely keep Nick looped in, and all of the input and advice or questions that you've asked him for, we also take that into consideration as well, because there have been things that, that the system currently doesn't allow for, and that, you definitely hear these questions, or you hear these things, and you're able to let us know.
Sure.
So anyway, well, thank you very much. Well, with that, I understand we have no calls and no email, so I then will thank you all for joining us today, and I know we've covered a lot of information, everything from clearing up FAQs, the QAD team out there, EIV, NGVMS, DIS updates, the extensive information Ielvo provided on referrals, case management, and the system. And we'll make sure that we put this all in an email for you. And that way, if there's any part of this that you missed, or any part that we covered too quickly or anything, definitely we'll put it in an email and you can read it, and contact us as always. So on behalf of all of us, thank you very much.